thanks for doing this interview. Hopefully it helps a lot of people that were in a similar position that you were. So we'll kind of start by getting at what that was. I'll just kind of, I'll give a little synopsis, and then if you can kind of fill in what you went through. You've had some form of foot pain on both sides for somewhere around 15 plus years, is that right?
Yeah, probably closer to 20, yeah.
And you're on your feet all day long for work. You're an active person, so this has been messing with your life for quite a long time, and you've sought treatment for it, and the primary treatment has been aimed at the diagnosis of plantar fasciitis, is that right?
Yes.
So you sought treatment for it. The treatment obviously wasn't working at least as much as you'd want it to, which led you to me, and then I specialize in orthopedics, but specifically in looking at your spine to see if that could be the underlying cause. And that's the route that we went down. And we've done 4 treatments thus far. It was over about 4 months' time, but 4 treatments. Mm-hmm. And now you've had relief.
Yeah.
So maybe we back up a little bit, and if you can kind of tell us when your symptoms first started, what you did for it, some of that stuff.
Yeah, so I remember it's been nearly 20 years. I'm in my mid-40s now, so I was about mid-20s. And when I think back about the progression of it, it was really after my first disc herniation in my lumbar spine. And that's when I started talking to my PT folk about orthotics and whatnot. So I went to a podiatrist, got the prescription orthotics. I was having, kind of just pain in my heels, bottom of my feet, and backs of my heels. And it wasn't terrible, but it just bothered me. And as the years went on, I would go to the podiatrist, and we did the orthotics. I did the ice rollers. I did the percussion massager to my calves. And, in the last few years, I was doing the boots at night, trying to keep my feet in a position and trying to sleep with, so first it started with 1 boot because I would do the worst foot. And then at some point I worked to 2 boots, and I was wearing boots at night, and it was, waking me up, and wasn't really, I'd find some relief in the morning, but as soon as I started moving around again, I was right back to where I started. So all of it, really, that's how it was. It was like the orthotics didn't even really help. It just kind of made my shoes less comfortable. And, maybe it was helping keep things at bay a little bit, but nothing was ever really solving my problem. And so that's when last year I started seeing your videos online about, hey, it might not be plantar fasciitis. If you do all this, that, and the other, and it's not helping, then obviously we're not getting to the root cause of it. So yeah, that's, so the pain over time progressed or just didn't go away.
And now, anywhere along your journey, I'm assuming you saw more than one PT or more than one podiatrist, right? Like, how many people did you approach about this?
So yeah, I've been to probably 2 or 3 podiatrists over the years, just because I moved or whatever, or found a guy. Okay, you got to go see my guy. So I went, but it was kind of the same recipe. It was, okay, let's look at your walk. This is where your pain is. Okay, it's been 3 to 5 years since you had orthotics. These ones don't work anymore. We need new ones. And with the PT was, I never really went to PT for this problem, but I'd seek it because, I've had a couple herniations in my lumbar spine over the years. The last one was probably 11 or 12 years ago, around there. I'll knock on wood or granite, but so that's, my PT was more heavily trying to help me with those problems. So the PT, I've had countless PT sessions, but all for my spine, but more to like strengthen my core and all that.
That core neutral strengthening, right? The bird dogs, the Palloff presses, the dying bugs, the planks, the side planks, all that stuff, right?
Yeah, absolutely.
Yeah. All that stuff that doesn't really work.
Yes.
When you told the PTs about your feet, what did they chalk that up to?
I didn't really focus on it much. I remember there was one, the first one that really started talking about it was I was more of a runner at the time. I don't do a lot of running anymore. They talk about
if you'd like an appointment, go to thespinaltruth.com and schedule today. We offer both in-person and telehealth appointments, and unlike the medical system, we look to the root of your problem. We look to find the cause, the why your problem, your symptoms are there in the first place. For your and feet, we expect but they weren't even quick correlating improvement. the two. We expect improvement in pain, range of motion, or strength in the first visit, and 50% or more improvement in most conditions within 4 to 5 sessions. So if you're tired of being in pain, if you're tired of the medical system and its approach failing you, and you want something different, go to thespinaltruth.com and schedule today. Now let's get back to the show. And then the podiatrist that you saw, did any podiatrist ask you any questions about your back?
I don't recall that ever being, any kind of focal point at all.
Yeah, so it's kind of funny because the PT who's treating your back isn't correlating that the back and the feet are the same problem.
Yeah.
And then the podiatrists aren't asking about it. And by the way, this interview is going to come out after a podcast that we just did on plantar fasciitis. And we start off by talking about this, how it normally starts with some form of back injury that you kind of get over, right? Like you recover from it, you forget about it, you did pills, injections, rest, maybe you did some PT, some strengthening in core neutral, your symptoms go away or diminish over time, and then you start getting some foot pain, knee pain, something, and you forget that you just recently had back pain, a month, 2 months, a year ago, 10 years ago. Mm-hmm. And you don't correlate the two together, and then when you go to whoever you go to, they get very myopic in their focus, and you say, I have foot pain, they say, let me look at your foot.
Yeah.
And it's just, we need a change. Like that shouldn't be the system. And it's super frustrating because to me, you tell me your symptoms were both sides, they were relatively constant, but you were having like numbness and tingling, so that's a nerve issue. Both sides typically means a nerve issue. You're not getting better with the conservative treatment, right? With the boots, with the stretching, with the massaging, with the orthotics. That's another sign that it's probably not plantar fasciitis. So like this wasn't hard, to recognize, right?
Yeah.
It took us, so we'll maybe jump forward a little bit. We started working together late September, early October, and we've only done 4 visits, but we spaced them out a good amount. But it really only took us about 2 visits, so 2 months for you to say like, hey, I'm definitely seeing progress. So can you kind of talk to that? Like what was the difference between what we did together? Because we've never met. You're in Seattle, right? And I'm in Pennsylvania, so we're a country apart. We've never met in person, but within 2 visits, you're seeing some change after 20 years.
Yeah. I mean, we talked about in the beginning, this is a problem that I've had for nearly 2 decades, so it wasn't an overnight, solution, but just kind of being consistent with the few things that you had me working on. I could tell right away that at first it kind of stirred it up a little bit. Of course, it's,
right.
But I just kept on with it, and I felt like even early on that I could not necessarily turn it off, but turn it down after doing these exercises. And then it got to the point where, me not walking right or standing right throughout the day or doing something to aggravate things, I could feel this, pain or tingling or whatever it is, but then I could definitely knock it down and kind of put the fire out with these. And that just got progressively better and better and better as the months have gone on. I definitely have, again, it's a 2-decade problem I'm trying to solve, over a number of months. So I still have days where, it doesn't feel great, but I've seen considerable and significant changes in just like how it feels daily and how I can help it improve. And the results stick around too. It's not like waking up in the morning, taking off the boots and then feeling it right away.
Yeah. Well, and we've talked about that, right? Like it does take some time and some consistency, but as long as you're seeing gradual improvements, you're able to stick with it, right?
Yeah.
And that's a message I try to get out there to people where it's like, look, if you give it 4 to 6 weeks and you're not seeing somewhere around 50% improvement, let's say it's 30 is still fine, somewhere around that type of improvement, and you're thinking this is the answer, then you're probably doing the wrong thing or to the wrong area. Right? And I mean, and that was you. And maybe talking a little bit about some of the symptoms, because I'm sure there's people out there that are going to have some similar, I have them written down here. Like when on your first visit, you were saying you can't lay on the couch because resting the backs of your heels on anything was painful, even like the bed.
Yeah.
Which obviously that makes sleeping uncomfortable. You said if you were to walk, like go for a walk, your symptoms would last for days. So not only did they come on intensely, but they stayed there for a long time. If you walked, like within 5 minutes, you'd get symptoms. The symptoms were also worse if you were to stand for any long period of time, which for that, it was like 5-10 minutes. You were getting symptoms sitting in the car, and primarily they were on the outside of your shins, your first 2 toes, and the bottom of your feet and heels. Like, so a lot of your lower leg.
Yeah.
Where are you? What has been kind of the biggest change from that to where you are now? What?
Well, I think it's just, throughout my day, it's not simply just, if I go on a park walk, yeah, I might feel it, but I have to wear, gear that, I have to put extra weight on my body. And I think that obviously affects my lower back, which can aggravate things way worse than if I just walk around in a t-shirt and shorts. So I will feel the symptoms. It's a lot different on a day where I have to, put weight on, and wear gear around versus just walking around in street gear. But the big difference is that I can either quiet it down, I call it, or shut it off when I'm feeling that, whether it's the hot nerve pain, sometimes the tingling or the shooting or throbbing pains in the ends of my toes. It's typically like my big toe, the second toe, feeling pain in the ends of those, or like in the bottom of my heels, or like I said, like when, at the end of the day, you just want to kick your feet up, whether it's on your couch, put a foot on a coffee table, or even just sitting up straight in bed. I could barely rest the back of my heel on anything, even just a mattress, without just feeling that hot nerve pain, just like, ringing through the area. And so I have to kind of turn my feet to their side, and it's still throbbing, but it was just almost unbearable to set my feet down. And that is something that's changed big time is, I can either, if I'm feeling that, I can go do my exercises and either quiet it or shut it off really. And then, it can be a little bit challenging to do these for me in particular where I'm at work or what I'm doing to do things in the middle of the day. So I try to preload it and do some exercises in the morning. If I can find some space or time to go do them in the middle of the day, if I'm starting to feel things, I'll do it. But, by the end of the day, my dogs are barking sometimes and I can definitely turn it down or turn it off.
Well, and you again, 2 decades worth of symptoms, you're on your feet, you're wearing gear, and I think your gear is it 50 pounds?
Yeah, it's somewhere between 40 and 50 pounds. Yeah.
But since we've started working together, I think you also stopped wearing your orthotics, right? You got away from that? Got away from the orthotics. Which,
my shoes are a lot more comfortable.
Which again is good. We're talking on the podcast that's going to air before this one about orthotics and how they sound good, and I've used them in my career, and I've used them as like a main treatment, and they sound like they should be the treatment, but at the end of the day, they're basically a brace that makes your foot stiffer and weaker over time. So, and you've had back pain too. The first exercise I had you do, because I get a lot of pushback on this. You've had back pain, you've had herniated disc. I think you've had back procedures, right? You had
shots or the
epidurals.
Epidurals, yeah. On the 2 big injuries I had, I did 2 shots on each injury. They were 5 to 8 years apart, but I haven't had any surgeries.
Okay, so 2, but you're verified herniations, right?
Yep.
and I had you do a whole bunch of bending forward with weight, right? The opposite of what everybody's told you to do. What was it like going through your mind? Were you thinking like, hey, this guy's telling me to, like, I'm literally telling you to bend forward with weight, which if anybody has a herniated disc, they're told not to do. They're told to protect their spine. They're told to keep themselves core neutral, right? They're told not to bend and lift weight. What was going through your mind when I had you do that?
I was a little skeptical. I was a little, psychologically, I was a little worried about it, doing the curl. Especially kind of on the return up, I was a little worried that something was going to pop and then I'd be down and out for, however long it takes. But, we started with a reasonable weight and didn't move up until it made sense. But I was very stiff, it felt...
If you're out there and you're in pain, if you're tired of the current medical system failing you over and over and over again, just giving you answers that numb you, pacify you to your symptoms, and are largely based on medication, injections, and surgery, and you want a different way, maybe even a better way, look for my book, The Spinal Truth, A New World of Medicine. In it, each chapter I talk about a different symptom, different condition, different body part, and how I view it a little bit differently than the current medical system and how my treatment has helped so many people out there when they've been let down with the typical approach. This is the way I think medicine should be. This is the change in healthcare I think we deserve. So thespinaltruth.com, you can look for my book on Amazon, Kindle, Apple, and on audio.
I wasn't super confident in the beginning. And
Sure.
so it did not bump up 5 pounds a week. I kept doing that weight till I kind of wrapped my head around it psychologically. I could move on, but I worked up, and it seemed like as I did that, not only was I feeling stronger and more confident, but that's where it tended to kind of unlock for me as I got a little bit higher in weight,
Where are you at now? What weight are you using for that movement?
I'm about 75 or 80 pounds.
Which is
and
great.
I feel like that's a pretty decent place for me right now. I mean, we haven't checked in. We'll check in, I guess, after this, but see if I need to keep going with it. But I feel like once I got around that 60, 70, 75 pounds, it started to just help that much more.
Yeah, and we've had that conversation because I've done this for myself as well, and I felt the same. And I've had hip and knee pain and even feet pain over the years, but again, didn't correlate it even for myself to my spine. So I started doing the same exercise, the same movement, and the first 2 weeks, I was so surprised how sore my back was, right? Mm-hmm. And a lot of people out there say, well, I don't have plantar it's not a back problem because I don't have back pain. It's just a foot problem. Well, I didn't have any back pain. I was having hip and knee pain. I didn't realize my back pain until I started using my back, right?
Yeah.
So, and I think that's what happens is we guard, we protect, we start to modify and adjust. And we had this conversation where I felt like as I got up in weight, finally something moved that wasn't moving and probably wasn't gonna move unless I kept this up over time and built weight on top of it. And then once that did, then just kind of everything unlocked from there.
Yeah, absolutely. Another thing that I really remember is we talked about that progression of symptoms when you're compressing that nerve, what it takes to kind of get to numb, right? And when you talked about kind of moving backwards, I was at some areas, especially at the ends of my toes, it was kind of that numbness. And then the tingling came back, and then it kind of hurt. I mean, it was back to kind of regular nerve pain again. And then I moved through that and past that to where, again, I could kind of turn it off or it subsided. But, that really struck me as I was going through it, going back, kind of reinvigorating the area again, or the nerve that is.
But it's like the opposite of when you sit on your leg and it falls asleep, right? You stand up and you work through these stages. And this is the information that I'm trying to get out there because it's not always clear that your foot pain is a back problem. And it's not always clear when you're recovering what recovery looks like. Because if you're having numbness and now it's painful, you're actually getting better.
Yeah,
right?
But you're thinking I need to stop this. This is not good.
Right. And you need somebody kind of checking that, making sure your motion looks good, making sure that it's the right progression. And then you need somebody, honestly, half the time, it's just you need somebody saying, no, it's okay, keep going, right? Talking you off the ledge, so to speak. Because again, I would much rather my leg be numb than in pain, but pain, physiologically speaking, is better. Pain is an improvement from numbness. So, you know, a lot of people out there hearing this, if you're doing something and your leg was numb, your foot was numb, and now it's painful, you're likely doing the right thing. You know, if that numbness is getting worse, you're likely doing the wrong thing.
Yeah.
And that's not something, I mean, did anybody ever explain that to you in the past?
No, never even thought about it, never heard of it. It's just like going to get help with my plantar fasciitis. There was never any connection to my lower back. You know, never talked about that progression of nerve pain to numbness or whatever, you know.
Well, and so obviously we treated the back. How's your back doing now compared to what it was?
It feels a lot better. I've had a couple aggravations along the way, you know, my own fault, or whether, you know, work things slipping, or, you know, things that would normally upset it. I recall in December something, you know, very minor, but it was like normally it'd take me kind of weeks to kind of feel less stiff, but I just kept doing the curls and the exercises, and I feel like I barely skipped a beat. You know, it might have taken a couple days to just not feel it as much, and then it just kind of went away. So it really helped with that too. I was a little, because I was out of town and we hadn't consulted you on it. I thought, well, maybe I'll just see if it helps, and it did. You know, I didn't know if I was supposed to keep doing it, but I did.
Well, and you talked, right? Like in general, you start with and if you're injured, you go back to a relatively reasonable amount of weight, and you see how you respond to that, and then you just start working up from there. And I'm not saying that everybody needs to move in this direction, although it's more and more common than you would think. Have you ever heard of McKenzie physical therapy? Did you ever see somebody like that?
No.
They do a lot of press-ups. They do a lot of extensions. Looks like a cobra pose, almost like a push-up, but you leave your pelvis on the ground. Did you ever do anything like that when you were getting your back?
Like Sphinx. I could never get to like seal pose. Or more of a Sphinx pose.
Right,
kind of deal.
right, yeah. So that's the complete opposite direction that we moved your spine in. That's what conventional treatment says to do. And again, I'm not saying nobody out there needs it, but it's a lot less common than we think. And a lot of people need to do exactly what we did together, the opposite. We need to flex it. We need to get your spine out of that locked position. And people are afraid of it because they're told not to. They're told that if they have a herniated disc or degenerative disc disease or disc bulge or whatever, they're told that they shouldn't move in that position. And so I'm glad that you're here kind of saying that, you know, you got up to 70, 80 pounds, which is a lot. That's a lot. And you're going past the floor too, right? Like you're not at your toes anymore. Now you're going actually past.
Yeah, I do bump it down. So I'll do special reps going past the floor, but I do bump the weight down a little bit.
What are you using if you go past the floor?
It's either like a 45 or a 55.
Yeah, which is, I mean, again, it's still a lot, right? It's still a lot in an end range position. So you're doing heavy weight, you're going past the floor, you're going to this movement, and your back's felt better than it has. Yeah, and it's
absolutely.
So if you were if somebody were to ask you, you know, about what this process was, you know, what it was like, what if you could kind of give a few, like a synopsis, what would you say?
Well, at first I wouldn't say I was skeptical, but I had never really connected the two things. So,
and I think you should be skeptical, right? I'm some guy on TikTok that you've never met in person telling you your foot pain's a back pain, right? I think you should be skeptical.
Yeah. Well, and that's it's kind of funny because I work with a lot of people that, you know, have foot problems, but they're really, I feel they're the same as me. They're just back problems. So they wear the same amount of gear and they've been doing it for years. And so that's, you know, I say, hey, I found a TikTok doc, and they kind of laugh or whatever, but I'm like, no, really, you know, and I try to preach it a lot, and I say you should look into this, and because they're the same path. It's like orthotics. I've been wearing orthotics for 10, 15 plus years, and they have back problems, but they also have these foot problems. But, you know, to anybody, it's definitely if the cortisone shots, if the taping, the boots, the orthotics, if that's been your path and you've done it for that many years, just like your videos say, like there's something else going on here. And so just, you know, I would just say, you know, just be open to this and just know something, you know, your back is likely a mess, so it's going to take a minute to get out of it, and it's going to be okay. Just make sure you're following the instructions and moving right. But if you keep up with it, hopefully you'll be like my case, where it's, just the more consistent you are with it, the better it'll get.
Yeah. Well, and it's funny because my patients, most of the time, they end up being kind of similar, and they're going around telling people like, well, hey, maybe it's your spine, right? And that's literally me. That's my message. And it makes me laugh because now you kind of know how I feel when, somebody's complaining about both their feet and there's some tingling and like sometimes it's there and it's not getting better, and you're like, well, I know it's your back. Like, and you tell them, hey, and you kind of say like, maybe it's your back. Has anybody looked at it? And you just get brushed off. People look at you like,
they don't even hear it.
Oh, right, yeah, and it's so frustrating. Yeah. Oh man, and it's like that with so many conditions, not just foot pain, plantar fasciitis, so many conditions out there. And so that's why, very thankful that you were willing to be here and tell your story and talk about it, because like what you said, just like with your buddies, your coworkers that are having the same history, the same, I feel this, I went through this, I saw this person. There's so many people out there exactly the same as you and your coworkers. It started with maybe a back problem, but they didn't even realize it. Then their main issues, their feet, and they're getting the cortisone, the taping, the boots, the orthotics, and it's not working, or it's only managing the symptoms, but they're still there. They're always still there, or they're always still at a similar level. They're not managed to anything worthwhile. And if anybody's listening to this, it's probably because it's your spine.
Mm-hmm. Yeah, absolutely.
I was looking at our visits. We've done 4 visits. You have pretty much 4 exercises to do over that time. How difficult, how easy, was it going through this process? We did 4 one-hour sessions, and then I had you do a lot on your own. Is it a lot of work? Is it, did it take up a lot of your time? What's it like?
Well, in the beginning, especially when I was trying to unlock areas, holding in certain positions, it took time. So I would say, especially early on, it would take me 15 to 20 minutes to get through these. And I would try to do it either just first thing throughout the day or pre-workout or whatever it was, just to get moving right for the day or the workout. So it did take a little bit of time because I was really trying to just focus and be methodical about it. Now that I'm in the place I am now, if I take a long time to do it, it might be like 10 minutes. But even just if I were to wake up and want to do it real quick before I move around a little bit. I'm a little stiff getting out of bed, but if I want to do it before I go to work or really get into my day, I can do it in like 5 to 7 minutes. It's not taking a half hour out of my day by any stretch of the imagination. So I do it, earlier in the day. I usually do a little bit in the afternoon before a workout, and then sometimes I even do it before I go to bed.
Well, and again, sounds reasonable, and it is work, and I do want to tell people that, right? Like, it's not an injection, it's not a pill, it's not taping, it's not massage, it's not somebody doing something for you. It's me showing you how to do something for yourself, right? Yeah. For the most part.
In my opinion, it's an investment, right? Yeah. So I'm investing in my health to get this better because I'm so sick and tired of dealing with it, and it's just gotten better. So I want to continue that progression. Like I said, I still have, bad days if I'm wearing a lot of weight for a long period of time, but, it's not constant anymore.
Well, and that question that I like to ask, right? Like that 0% when we started, you couldn't rest your feet on some symptoms. You couldn't stand or walk for more than 5 minutes without symptoms. Sitting was painful. You're wearing orthotics. That's your 0. 100% is where you want to and expect to get back to. What would you say you're at now after we've been working together for a little bit?
With all told, with the good days and the bad days, all kind of, totality, I'd say I'm about, if you catch me on a good day, I'd say like 70-75%. And if I'm on a bad day, I'd say, I'm about 65% of the way, 65% of the way there. But considering, when we started, it's like, it's so much better. It's been totally worth all the time I put into it.
Good. I'm glad. It's why I'm here, right? Why I'm doing this on TikTok and wrote my book. I'm trying to get this information out there because not only do I see it in my patients, I saw it in myself. I was seeking treatment for a lot of shoulder pain, and I just wasn't getting the answers, and I was doing everything out there, and nothing was helping. And it wasn't until I really addressed my spine until I got anywhere close to meaningful relief, meaningful results, right? And so much of the treatment out there is just focused on palliative, passive. It makes you feel good in the moment, but it doesn't last, and it only treats the symptoms. And I see a better way for our medical system to behave and to evaluate and to treat a lot of symptoms and conditions out there. And that's the message that I want to get out. And thank you for helping share that. And telling your coworkers and telling your people, keep fighting the good fight. Telling people it might be their spine, because you'll get somebody, and and at the end of the day, if you've been going through something for 2 decades, and if you haven't been able to stand, and I've had a lot of people that their biggest issue is now they can kind of play with their kids the way they've wanted to. Now they can be active with their family, and I mean, that's life-changing, right? When you're in constant pain, when somebody says, hey, let's go out for a walk, and you're thinking, oh man, my feet are just gonna hurt, my back's gonna hurt, something's gonna hurt, and that's your first thought other than, oh, I'm gonna enjoy a walk with my kids or my family, right? Once that pressure comes off, that's a big change.
Yeah, absolutely. Yep.
Yeah, so thank you, Aaron, for being here and sharing your story. I'm sure there's a lot of people out there that they're gonna have the same, your message is gonna resonate with them, so it's very helpful.
Yeah, well, thank you for all you've done for me too. I mean, I'm in a much different place now, so thank you.
Great.